We're going to talk about a new way of looking at youth and beauty, which is going to be quite different from probably a lot of things that you have been taught about rejuvenation. Instead of lifting, we're looking at volume as being a cornerstone to rejuvenation. So it's a very different paradigm. And we're going to first of all establish the paradigm so that you can understand the concepts of the beauty. Then we're going to go through the dynamics of how to do it to achieve the results. And then finally, I'm going to go through some of my results. And it's not just going to be a smorgasbord of results, but really I want you to sit there and try to analyze exactly what I've done and why that's beneficial. And there is a level of artistry that's involved that you don't necessarily have to have when you first start this whole procedure out, but you can acquire over time. So we have to first understand what is a youthful face, and that may almost sound silly because unfortunately a lot of times when you go out there you go, well, I know what a young face is, I see one all the time. But if you want to do it from an analytical perspective and try to figure out how you're going to achieve a youthful face, you have to really begin to understand the dynamics of it. Otherwise you get a lot of people that look very tight but they don't look very youthful. So it's a concept from the ground up that I had to relearn even after fellowship. So let's start with probably an easy target, someone at 50 years of age that looks wonderful. Now why does she look good? Let's start from the top. Let's start from the brow eyelid complex. That brow is low, full, and round. And if you understand what I just said in one breath, it's the antithesis of a brow lift. It's the opposite of a blepharoplasty. It's everything you think about sculpting and skeletonizing and elevating and taking away the frame of the eye, which is the opposite of what really should be done. I mean, yes, brow lifts occasionally are okay, but oftentimes they can alter an identity, which is fundamentally an error. If you look at that brow, it's tremendously low and tremendously full. If you see how much fat is around that eye, that is what makes the eye look rested and feminine and youthful. And if you look back at her photo about 20 years prior, you can see that's exactly what she had. So how do we start by understanding youth? We start by using a patient's old photographs, because in that photograph we begin to understand how that person used to look. How often would you begin by saying, when you're looking to a patient to rejuvenate them, how did you used to look like? Do you care? No, you start with, okay, you need your brows lifted, you need this tuck, you need that tuck. Well, why don't you start back and go, what's your previous identity, so that you don't alter that identity? That's a very fundamental thing. So clearly this is an extreme example. You know, when I did brow lifts, and I haven't done them in about 2 years now, I wouldn't make them this extreme. But this is still an extreme. And if you understand fundamentally what sucking away fat, elevation, and sculpting does, it's essentially the same thing that aging does, which is taking away volume around the eyes. And I'm going to sort of answer some of those ideas of when a blepharoplasty would have a positive role and when it wouldn't, and how to do it in combination with fat grafting. And the book that I wrote that came out by Lippincott in late '06 is called Complementary Fat Grafting. The idea is how to marry, not to necessarily throw out the baby with the bathwater, but to how to look at lifting procedures as an integral element to volume. This may not be entirely a resident lecture, maybe more for the practitioner, but I think it will help train you in thinking. So what are we talking about? What are the keys when we look at volume shaping and we look at rejuvenation? We have to look at the full volume and shape of a face. The heart-shaped face of youth, the triangle. You saw in Christy Brinkley the triangle like this. What happens over time is that triangle flips. The jowls get more prominent and everything begins to move toward the lower face. Both, yes, gravity, and also because of volume gain. So I just talked about volume loss, but there is a component of volume loss and volume gain. So what we have to do is look at our friends dermatologists who really don't look at gravity. They look at hypertrophy-atrophy models. And I really sort of marry the idea that we have to look at our colleagues, dermatologists and facial plastic surgeons, to find out what exactly is the right strategies. Also understanding that the face of youth has tremendous highlights, a lot of luminosity. I like that word because it captures exactly what I'm trying to do. Because when I see a youthful face walk through my door that I've created, even 30 feet away, the presence is there. I can see they look great. Before I can see a wrinkle, before I can see the brow position, they look youthful. And really no transition zones. Very few ideas of where one part transitions to another. So that whole idea at the end, framing the eye, is a key, because we have to be able, we have to frame the eye. So it's the opposite of unframing the eye, which is a brow lift and skin removal. So This is a mother-daughter pairing. If you look at the mother, you can see that look at the daughter, she's got the triangle we talked about going in a heart-shaped face. The mother, who's had some weight gain, has also had some volumetric loss in the upper face, and you can actually see the inversion of the triangle. So the attention is pulled away from the eyes down to the lower face. So if you look at that eye, you may say, well, she needs a brow lift. Come on, Sam, this is easy. How about an eyelid surgery? Well, maybe, maybe not. And we're going to go through some of those, probably a little bit more the technical details in a moment. So what do we do here? This is a great metaphor that I like to use. When we're youthful, we are great. Over time, we become a raisin. So the question is, why should we take that raisin, cut, pull, stretch, lift it into a pea? Because a pea does not look like a grape. It looks like a different animal. So the idea is to try to get someone looking back to where they are, and filling is a critical element to that. So the other problem oftentimes is, about 80% of my rejuvenative patients, other than hair restoration, are females. And so females really, they have a different way of looking at the world than men. And as men, we probably don't own a very magnified lens, but unfortunately the way you put on makeup is very close to a mirror, and then everything looks distorted. Everything looks terrible. It's that one minor little flaw that captivates their imagination, their mind, and they get obsessed with it, even when they pass by a normal mirror. So you have to first understand what problem they're seeing to get into their mind so that you can rectify it. Because the thing that I want to attract you to think about is throw away the 8x, 10x magnifying mirror. Because you may not be able, as a guy, as an XY chromosome, understand what is the woman looking at. And you may try to appeal to that, but the problem ultimately is you satisfy that person, no one else can see that person looks rested or good because they're that close to the mirror. So when you look at my before and after photos, when you look at other people, when you're trying to judge beauty, you got to pull it back 5 feet. Look at them with normal overhead lights, not like this where there's scant lighting or uneven lighting, but uniform overhead lights. The way I take my before and after photographs were all done without fill lights because I think they help establish how you and I see each other in a social, professional engagement. Because if you think about it, 99.9% of the time of our life, we live in a world where we have only overhead lights, whether it's outdoors or indoors. So fundamentally, think about the facial shape. It's the whole global aspect of the face that's important. And some small things about it is, if I'm talking about volume, can we just put a malar implant? Can we just go put a chin implant in? I'm going to show you in some instances why that not necessarily is the case to get a good result in terms of volume restoration. And finally, understand the gender differences. If you fill everyone the same, you're going to make everyone look the same. What happens during the aging process is that women become more masculine. Men become more masculine. If you take men back, you can feminize a face. Oftentimes, men look a little bit more rugged as they get older, and you've got to ask the patient, where does that person want to go, based on psychological motivations and also photographs of the past. So using those old photographs can be an incredibly important blueprint of understanding, oh, you wanted this, I thought you wanted that. And so that's my starting point of communication, is using an old photograph. So this may be a challenge for you guys to start asking your patients, if you're going to do rejuvenative procedures, let me see an old photograph, see where you started. So it's a patient re-education, just to reiterate this, is taking the person and bringing them farther away from a mirror that they may be accustomed to seeing. Let's talk about the principles of the technical principles. When you start doing fat grafting really is irreversible. You don't want to go in there and start overfilling patients because it's extremely hard to correct. You want to stay more conservative until you start getting an aesthetic eye of seeing what your results look like over a period of 1 year to 2 years and beyond. So fat also you have to understand how to do it to avoid complications, and also to understand where fat works better than other places. Because a lot of times the problem with the past of fat not lasting or fat not working well is also a fundamental error of where to put it. If you put it into lips, into lines, yes, you can help both of those. Without a doubt, you could go up there and show me great photos of correction of facial lines and lips. But the problem also is that there are many better techniques to correct those than fat. Fat, in my opinion, is really looking at to be used as a contour agent to help refill around the periorbital region in the chin and the cheeks. And that's really the essential element. So, the complementary approach, just briefly, is the idea that we don't have to do everything through fat. The whole world doesn't have to be filtered through fat. But in my opinion, it is the cornerstone to rejuvenation. I combine it with selective transconj blephs, selective upper eyelid skin removals without muscle removal, and rarely brow lifts today, and facelifts, of course. So this book that I wrote really tries to make it easy. Make it more like a cookbook recipe for someone approaching it for the first time. We have 16 videos in there to help you start with this so it doesn't become this overly taxing artistic endeavor. Starting with the concept of volumetric foundation, we basically allow you to start with, okay, here are the number of cc's you need in this distribution so that the patient can consistently get a